Okay, so factors affecting range of motion, of course, structure and shape, the strength and tautness of the ligament, so the tighter the ligaments, the less movement we're going to see, arrangement and tension of the muscles around that joint, contact of soft parts, hormones, and disuse. Select joints. At the temporomandibular joint, we will see a few ligaments. We have the articular capsule, but here we have a lateral ligament connecting the mandible to the zygomatic bone. Then we have a stylomandibular ligament connecting the styloid of the temporal bone to the mandible. Okay. Internal look, sphenomandibular, so sphenoid to the mandible. Then stylomandibular again, styloid to the mandible. Okay, this is a look at the way the articular capsule is arranged. At the shoulder joint, there will be a few structures that I do want you to know for testing purposes. So first, we have two bursa found here. We have the subacromial, which means that bursa is below the acromion. And then we have the subscapular, so bursa is below the scapula. And then a few ligaments here. So just above that bursa, keeping it in place, we have the coracoacromial ligament. Most of these ligaments and structures will be named for their placement or where they are attached. So it is attached to the coracoid process and the acromion. Then we have the acromioclavicular ligament, so attaching the acromion to the clavicle. This is where you find the AC joint. And then we have a trapezoid ligament. This is not named for what structures it attaches, but it's here. So know these three ligaments and these two bursa. Okay, another look. Glenoid cavity right here. The glenohumeral ligaments, so creating more of a pocket to hold the humerus in place. And then right here, this small little lip, small little edge, this is going to be that glenoid labrum. So if you were to have a labral tear, that is what is actually tearing. All right, this is the arrangement of that cavity, the synovial cavity here. We can see we surround the entire head of the humerus. More of an anatomical look. At the elbow, we have a few ligaments to take a look at. Ulnar collateral ligament. We are connecting the ulna to the humerus. And the radial collateral ligament, connecting the radius to the ulna and humerus. And then we have a bursa, the olecranon bursa. Okay, at the hip joint, we have three main ligaments. They are named for what part of the hip bone attaches to the femur. So we have the iliofemoral ligament, seen here. We have the pubofemoral ligament, seen there. And the ischiofemoral ligament on the posterior side. Okay, you can see that synovial cavity here surrounding the head of the femur. Okay, at the knee, we have quite a few ligaments to look at. To start off, we have collateral ligaments, fibular or lateral collateral ligament, and then a tibial collateral ligament, or the medial collateral ligament. Okay, so these are for lateral stabilization of the knee. Internally, between the femur and the tibia, we have the anterior cruciate ligament and posterior cruciate ligament, also known as the ACL and PCL. So key defining factors here, the ACL attaches anteriorly on the tibia. The posterior collateral ligament attaches posteriorly on the tibia. So that is the way to tell the difference. Okay, and then we have our articular cartilage. We have the meniscus, which is creating that cushion for the femur to articulate upon. Okay. All right, so a sagittal view, we have three bursa to take a look at. We have the suprapatellar, prepatellar, and infrapatellar. So as you can see, they're all named for the region at which they are found around the patella. Pre being before, infra being below, supra pertaining to being above. Do know those bursa. Okay, and then we have one more ligament, the patellar ligament. This is coming from the patella to the tibia, attaching at that tibial tuberosity. Okay, most of these other ligaments you can see are again for stabilizing that knee joint. Since there is a lot of movement and a lot of weight put on this joint, this is why we see so many ligaments found here. More of an anatomical view. All right, so the rest is going to be more of clinical application. Aging in joints as we age, decreased production of synovial fluid for maintaining the health of that joint. Articular cartilage thins and loss of ligament length and flexibility, so we become more rigid in those ligaments. Arthroplasty, we are replacing a joint. So this is a quick look at the hip joint. This is an artificial acetabulum, and then the head of the femur, femur neck, and an artificial shaft of the femur. Knee replacement, we grind away the anterior and inferior surface of that femur. We take away some of that patella there, and then we see the superior portion of the tibia being removed as well, and then we replace them with new components. That is it for the joint chapter. Next we will see the muscles.